Hello, friends. I don't think it's any surprise that mental illness, mental health struggles, burnout is something that a lot of healthcare workers face. But today I wanted to talk about it and really address it because we talk about it loosely a lot, right? We're like, oh yeah, there's like a lot of mental health struggles with this. There's a lot of burnout, but like what does that actually mean? And sorry, I hear myself talking in my other stream. I had to close it. I was like, wait, who else is talking? And then I realized it was myself. I think it's something that we should talk about more so we can identify it better, see what the actual data is about it, because it's kind of shocking when you really, really look at it. Just kind of chat amongst ourselves. I have a great panel that's going to be here today that we can talk about how we've experienced it. See if we have any coping mechanisms that anyone else has come up with, because the job is really heavy, right? This isn't a job where, when my husband comes home from work, I'm like, oh, how did it go? And he was like, oh, it's fine. Nobody died, but we can't, and he says it in a joking way, right? But like, we can't say that in a joking way because like more than likely someone probably did, or it's very realistic, and that's a weird working environment to be in, right? So I wanted to take today to kind of explain things of, hey, I wish I would have known this because I would have done things differently. Had I started now and known what I know now, I would have started to implement different things. I would recognize things, so we can kind of go through that, give you some resources to handle this if this is something that's affecting you, and just kind of hopefully makes people more aware of it if you're either in it or you're living around it, to know like this is very normal and we need to do something about it and start addressing it, but we can't address it unless we get mad. So apparently that's what we do here now, is we just get mad about all sorts of things. So I am going to bring our beautiful and very handsome panel members in today. There's a bunch of them today. We'll let them introduce themselves, and then we will get started. If you are watching in the chat, let us know how your mental health is today on a scale of 0 to 10. 0 being like, I am unable to get out of bed. 10 being like, in my mind, it's just a field of sunflowers. And that will let us know where 1, you are, and 2, it makes the stream happy. And then YouTube tells other people to go watch it. Okay, ready, set, go. I don't have a thing, so we're just going to add everyone slowly. Oh, not you. Okay. That's where we are today. I would say I'm mentally so when we go around and introduce ourselves, we can say where we are mentally at. I'm probably at a 3 because my children aren't sleeping for like a week straight. And that's about where I get. And I feel like the world is ending. And I know it's not, which is helpful. It's helpful to know why you feel like nothing is okay. But man, oh man, I'm tired. Like, I feel like I have a newborn. So let's go around really quick. If you're new, I'm Liz. I'm a family nurse practitioner. I'm not practicing because I got madly burned out after COVID. And we were going to talk about words we aren't allowed to say, and I immediately said it about the pandemic. And I now am just trying to get everyone else on the internet as mad as I am about all the things so we can make change. And these lovely humans are here to actually help implement because they have really good ideas. So that is me. Bridget is new on our panel. Would you like to introduce yourself next? Also, all of their social media is linked down below. They're great. You should go check them out.
Hi, Liz. Thank you so much for having me today. My name is Bridget. I'm a family nurse practitioner. I have worked in psych, and today, where's my mental health at? At a 6. I'm recovering from a procedure I had last week.
Ooh. I hope you're feeling okay. Better. Or they gave you good drugs.
Good enough to be here.
Okay, good. Also, Chad just had to leave, I think, go deliver a baby. He's a midwife. He said, I'm on call with a couple in labor. So if I disappear, and then he immediately disappeared. So good luck with the baby. I hope it comes out fast. Adrienne, would you like to go next?
Sure. My name is Adrienne, Nurse Adrienne RN. I'm on YouTube and TikTok. You can also find me on Instagram. I have a long history working for a union as a union organizer, as a nurse at the bedside for 12 years, and then became a regulatory expert in California on airborne disease, Cal/OSHA, hospital licensing, all that good stuff. So that's kind of some of my wheelhouses. Glad to be here.
Awesome. Also, Bridget, you already have fans. Way to go. Your channel helped me so much with psych class. Amazing. Perfect. And now he got her here. Vanessa, would you like to go next? Oh, where's our names? Oh, there we go.
Hi, hi, everyone. I'm Vanessa, also known as Mama Nurse. I am a trauma surgical ICU nurse of 8 years and a mother of 4. I would say my mental health today, probably about a 6, 7, going through the moving process and all the stress of that. So, but tomorrow's my birthday, so it'll work out.
Yes. And if you've been around here, you know that Mama Nurse and Nurse Scott are our even keeled, everything is going to be fine people. So that doesn't shock me that you are able to move while being a 6.
Yes.
That does not shock me. Bree, if you're familiar with my channel at all, has been on here. I interviewed her a while ago for about being an acute care nurse practitioner. So if you haven't seen that, you should go back and watch it. She has her own channel. It's great. She does the TikToks. They're great. Go for it.
TikTok is a minefield. If you're asking my mental health on a TikTok day, it's pretty poor. All the doctors of TikTok like to keep me in my place. So.
Oh, yes. Oh, yes. Oh, yes.
But yeah, as she said, I'm Bree. I'm an RN NP mentor. I do a lot of interview strategy stuff. So I do mock interviews for nurses and NPs. In general, I just like to help people achieve their goals, particularly in career-related stuff with NPs, because it's so hard to find a job as an NP these days. So that's sort of what I do. I still work full-time. I am a critical care nurse practitioner. So the pandemic definitely had an effect on my mental health. Lots to say on this show. Lots to say.
We're glad you're here. And our co-host.
Hey, everybody.
Scott.
Nurse Scott here. How are you? My name is Scott. I have the Nurse Scott YouTube channel, emergency room nurse for 25 years. And then the last 6 years now, disabled with a bad back, but going back to school to be a family nurse practitioner. And I am doing pretty well, considering 2 nights ago, I completely wiped my hard drive. And my entire life is gone, including the term paper I have coming up.
Oh no, because you were such a good student and you work ahead.
Exactly. But I didn't turn it in early because anyway, I should have. Anyway, long story short, I used the recovery software and I had some things on Google Drive and I got back most everything most important. I mean, I went through all the stages of Kubler-Ross, right? I'm just like, no, denial. Okay, bargaining. Okay, please just give me my term paper back and everything else you can have. Okay, universe. Anyway, it all worked out. So surprisingly, now that that's all over, I'm like at an 8 or 9. I'm doing really well. I'm going to study after this. It's a beautiful 74-degree day in San Francisco. It's sunny and my dogs are chilling out. So, and I was going to mention too, I have a bachelor's degree in psychology, and I used to work with an on-campus crisis hotline. So I have probably a little more to contribute to this topic than, like say the abortion debate.
Awesome.
Glad to be.
Well, thank you for being here, everyone. Also, if you are in school, Scott's proof that you're going to be fine because he's in patho right now, advanced patho, and he's at an 8 or a 9. So I'm just saying it's going to be okay. You're all much more resilient than me. I was not. So a lot in the chat. We're at 3, 4, 5, 5, lots of 5s. Okay. So chat, we're going to try to get on these people's levels. They're rolling in the high numbers here. We're going to try. We have Brittany. Thanks for being a channel member. I appreciate you. Happy early birthday, Mama Nurse. Hello. Sophia. There we are. How are you? I saw somebody say they were a first time. Oh, Oblio, finally made a live stream. Yay for me. Yay for you. Okay. So let us get rolling. So the thing that made me really want to talk about this, and I think someone had set it up here, I want to give a quick discussion warning type of thing. Quaint on Quaint said, thank you. I'll be starting nursing school next semester. So I love to hear honest discord. It's going to be very honest. Okay. The goal of this is not to make you discouraged. It's to be like, hey, this is what I wish I would have known I was kind of walking into, and how to prevent what has happened to a lot of people from hopefully happening to you. Because I think a lot of us think like, oh, a lot of people struggle with this thing, but I'm going to be fine. At least that was me walking into it. It was like, I'm a very resilient human. And it took about 7 years for that to come and slap me in the face and be like, I am not good. Like things are rough. So we will be very honest. If you are not in the place to want to hear honest discussions about hard mental health things, we will be talking about, we can't say certain words on YouTube or they don't like it, but like permanently exiting life. We can call it clocking out because one of the resources we have is called Don't Clock Out. We will be talking about that. If that's not for you today, that is 100% fine. Go. But we will be talking about that, being pretty open and going over things like that. So hopefully it helps people who are just entering a situation like this. Ooh, and we have one more person. Naya, do you say Naya or Nia?
It's Nia. Can you hear me?
Perfect. I can hear you. Would you like to introduce yourself super quick?
Sure. I'm a patient care associate and have been for the last 3.5 years at a hospital. And I started in the nutrition department, actually.
Awesome.
I had a lot of experience with burnout so far. I know there's people that have way more experience in here than me, but I had some tips and things that I also found pretty helpful.
Perfect. Well, thank you so much for being here. Nia is also a new one in our group. So we have a good little new group today. And it's not a competition about who's more burned out, because really it's your own caliber of where it is plenty. We also have Nurse Nander in the chat. Hello, Nurse Nander. If you don't follow her on the TikToks, get with it, friend. Get with it for real. Okay. So the thing that really sparked this conversation for me is I was scrolling on YouTube or Instagram, something on social media. And I saw a post made by a nurse that I think it was his fiance or his wife had clocked out. She was a first-year resident. And it reminded me of how many different stories you see about that, right? We see a ton of different stories about people in med school, particularly some people in nursing school, a lot of people in residency who end up harming themselves or having severely difficult mental health because of the nature of our jobs, right? We see some of the most yucky things. You see some really great things, right? But so I had seen that in the beginning of the week, and then yesterday I was talking with my one of my new neighbors, and they were like, "Oh, what do you do?" And I said, "Oh, I'm a nurse." And they said, "Oh, you've probably seen some like crazy stuff." And like they obviously didn't mean anything by it, right? And I was just like, immediately through my brain, I started having some very vivid and horrifying images of like, I guess you could call that crazy, but like and they were like, I've always wanted to like do something like that. And in my mind, I was just immediately like, the things I'm picturing right now are horrifying, right? It's children dying. It is horrible, horrible. Like the first time I saw someone die in front of me, that's like all of the different people, horrible things that you're like, I, at the time, didn't really process that very well. But now, 10 years later, my neighbor asked me, "Oh, you've seen some interesting, cool stuff." And I'm like, as I like stand there and you're like processing all of this and you're like, wow, like I need a lot more therapy. You know what I mean? So like that happens. And it kind of was like, I think we should talk about it today and just kind of discuss so that we can hopefully implement some things that I wish I had started doing beforehand, and also talk about the fact that you're not the only one feeling like that if you are. Because even with that, I was like, oh, like I'm struggling later, like now. In case you aren't familiar, I left primary care. So I'm a nurse practitioner. I worked in primary care, and I got so frustrated with the healthcare system. And then after like the pandemic, having to, figure out how are we going to make this go online? And then a bunch of people just lying all the time and showing up and exposing all of our staff and then threatening to come in and like hurt everybody because things weren't how they wanted. I was just like, I just need like a break from that and a minute. And when I took that break, it was almost like everything else sort of like started coming back like that. Like all of the stuff you saw like over the years in the hospital, because you kind of stop for a minute, right? And you like think, and that's when it can get dangerous. So I wanted to talk about it today. Scott, go for it.
This may be as good a place as any to talk about reframing. This is what I'm not a therapist, but I've been in therapy and I've studied this kind of stuff. One thing that's really useful is reframing. It's how you think about something. And there are different examples, but one is like an exam. It's the enemy. And I'm going through this right now because my poor performance on my first exam. I've always framed it as, look, this is my opportunity to show what I know. It's not the enemy. The exam is not the enemy. It's like, I've been studying hard. Ask me some questions. I'm happy to answer the questions. I'm happy to show you what I know. Now I'm kind of moving into where everybody else is, where the exam is a threat and it's something to worry about. And I hope they don't ask questions I don't know the answers to and how will I do. But as far as work reframing, I've said this before, and I want to share it again, that my friends in college went on to be band directors and choir directors in high schools. They don't see what happens in the world with people getting shot and people getting abused and people overdosing, and it all is happening, but their profession isn't one that lets them see that. I'm in the ER, and I chose to be in the ER because I wanted to be witness to that. And so and I've always looked at it as a privilege of being able to witness all the crap that you're talking about. You know, I've had the same thing. People say, oh, I'm an ER nurse. Oh, you must have seen some shit. I'm like, yeah, I really have. And I don't discuss it with them, but it's been a privilege to see that stuff. They don't let anybody in that trauma room. You have to earn your way in, and you have to earn your place there to keep it. And so, yeah, it's sad, but at least you were participating on the side of life, on the side of good. And if they had any chance of living, you were giving them that. So how you think about things makes a big difference. It's a challenge. It's not always easy, but I want to bring that up as a kind of a big technique to deal with preventing burnout.
Yeah. And I would only push back on that a little and just say, you have to be careful with that, right? Because I've gotten into the thing of that before too, of like, oh, I need to view this like positively only, because there are a lot of positive things with it. And I've been through different swings. I feel like sometimes I'm like, oh, I saw so many like good things. Like, yes, I saw a lot of hard things, but I also saw a lot of good things. And like, it was really cool that I was able to be there and see those things. But I just think with that mentality, we have to be careful not to like, because you can be really hard on yourself, because sometimes you just you can't get out of that, like, this is really hard. I should be. And so then I don't know if anyone else is like this, then I'll get into like, well, I'm beating myself up because I should be able to only see the positive in it. That like, this is an honor. And then you're almost double hating yourself because you're like, oh, I feel like I couldn't hang and do it. And now I should try to reframe it, but my brain's not wanting to reframe it because this is just a mess. So I think
that goes without saying that there's I want to be in a good place at work, and I want to look at things the right way. But then if you're not there yet, not to beat yourself up over it, that does what you just said, compounds the problem. So I would agree with there.
I think what we're talking about too is the chronic impact here, is that the qualifying distinguishing factor in even before the pandemic was the chronic like weight and the chronic repetitive moral injury already happening in healthcare, already happening to nurses and everybody in healthcare really, but really, nurses are at the forefront, and physicians and providers, and that chronic nature. And when we're talking about PTSD, right, and how you're saying it hits you later, that happened to me. I mean, I've been off work since last October, and I've gone through all kinds of phases of awareness and self-awareness and where am I at? And I was on the outside in a regulatory standpoint during the P, and managing 10,000 nurses, like being responsible, feeling like I alone had the responsibility of the safety and lives of 10,000 nurses, and just a little bit of pressure, right? But every day having that a day in and day out, and really then just seeing almost a losing battle, just like healthcare workers saw directly in the hospitals. There's a chronic nature to that. And it's also like the delayed onset PTSD, right? Which is a real phenomenon. But I wanted to point out that like burnout, had just been added to the ICD-11 in 2019, right before the pandemic, which is a work phenomenon, only exclusively a work phenomenon. And so it's really interesting how that was added. And now we have a whole body of knowledge and research that is supporting that, and really some really good data now. We've got some pretty good surveys and research. So I just wanted to add that, because that a delayed expression PTSD is real. And I think one of you is a psych. Is one of you a psych MP? Somebody here teach psych? Oh, okay. So that's a component. And so we don't always see that when we have that moral injury, and then and it doesn't help when we don't have that empathetic witness, because what is trauma? It's a lack of an empathetic witness. So this is like the soldiers that don't, rotate out, that just stay in the battlefield for, 3-4, rounds, not go rotating out in 9 months or 11 months, and repetitive on top of, I'm doing something I may not agree with, I don't really believe in, this is really going against the grain. It could be done better. Oh, and I'm actually literally, my life is at risk too. So there's a lot that healthcare workers and nurses have gone through. And I think we really need to, we're going to have to take some time and really figure this out of what are the resources. Some of the resources have dried up, for mental health. It's not always easy to get mental health. There's not always providers available. And no matter, I had the best insurance in the world, there just weren't any providers in my area, in Southern California. And so there was nothing available. I mean, so it also doesn't, sometimes we have to make those hard and fast choices to step out, because we're not going to be able to reframe something we can't control, right? If we don't have a locus of control, then it's going to be very difficult to not continue re-traumatizing ourselves in that paradigm.
Adrian, I'm curious where you got that definition. I love that trauma being the lack of an empathetic witness, because it almost seems like the solution to the problem is right there in the term, in the definition.
Well, it is, but this is a complex trauma, right? So the lack of an empathetic witness, right? So it's when we look at when we look at other types of trauma, right? We look at, okay, if you had somebody who you knew who loved you and cared about you while you were going through some crazy stuff as a kid, right? That actually is a mitigating factor mentally in our psychoneurobiology that helps us like stay above water mentally, right? But the lack of that empathetic witness, which, it could have been for a moment, people honking their horns outside of hospitals and the rah-rahs and things like that. But this is kind of a much bigger issue, more complex, because you also have the moral injury going on. You've got the, how did these employers behave horribly? Even in a state like California, did they follow the law? No, nobody at all followed the law. Nobody had the stockpile in California they were supposed to have for 10 years, right? Of PPE. Nurses were being suspended for wearing masks. It was about the public image. I mean, so you've got, when we all knew it was, airborne, right? We all knew that. There was no doubt in any of our minds it was airborne, but we're being told, no, it's, we don't know what it is. It's, let's Lysol our hands. So again, when you've got 5,000 points of contradiction going on, that it has become such a complex level of trauma for healthcare workers. It is really hard to unwind it, and so you have to figure out, okay, for me as an individual, how am I being impacted, and what are the signs and symptoms I'm showing, and are they chronic, right? And we're talking prolonged for more than 30 days by definition.
As far as prevention, though, it sounds like if you have an empathetic witness, if you're able to go home and say, and tell somebody all those conflicts and all the moral injury, all of it, having someone that can help mitigate, like you said, that can help.
Well, it's not, so that's trauma bonding. So that's actually not an empathetic witness. So empathetic witness is somebody who's like actually there and says, hey, I saw that. Like I got my nose broken once because I'm gay. Right. So there was a group of us. It was a much different environment in our recovery because we had each other and we were like, oh yeah, we were there. We saw it. This happened. Right. Versus I'm just alone on a street corner laying in the dirt. Right. So that's a very different, it's not sympathy. It's an empathetic witness. So that
it's a shared experience.
A shared experience, but then you're not trauma bonding. So it's a real distinction, right? And so it's kind of like, there are those people, right, that go through war, go through battles, and they're like, hey, I only can talk to this person, right? And if you've known anybody in the military, you know what I'm talking about. But they can't share it with anybody else because nobody else understands. Nursing is kind of like that, right? And so we know our tribe. But then we also have to figure out, okay, we can stay in the muck of like trauma bonding, but we have to like help elevate each other and bring each other up and out, right? But everybody is subjective. So it's a very complex issue. I've taught a few classes on this. So I've done a lot of research on this issue, but I want to let other people speak, but I just want to add that in there to help the viewers kind of think about this. Yeah.
And know that this is not just you.
Right.
That was, like this is an actual thing. Cause I think a lot of times, like, at least when I'm fairly immersed in like knowing like, okay, this is going to be normal. And like, when I realized I started experiencing a lot of this, I was like, I think this is something that's normal. But even at the back of my mind, I was like, or maybe you're just weak. you know, like everyone else seems to be able to be handling this.
The gaslighting, right? It's
exactly.
We are so accustomed to gaslighting, being gaslit in healthcare by so many different directions and such an insidious ways. It is so hard, even for somebody like myself and the roles I've been in, to just be, not be like, okay, I just got to do it. I got to be a team player. I got to go in there. I'm going to get 4 hours sleep. I'm going to do 5 20-hour shifts in a row because of the team. You get into like the team mentality versus the, my employer or whatever they want me to do. I mean, but again, is that really what's best for us and for the self?
And it's hard too, because so few other people, kind of like you were talking about with military stuff, get it. And you don't necessarily always want to talk about it with the people who do get it, but you also can't talk about it with like people in your actual life, because you're like, you don't have a clue, like which is to no fault of theirs. But like, if I come home, my friend or my husband, they're like, oh, how was your work? And you're imagining your work day and you're like, oh, well, I was coding an 11-year-old it was a horrible code. They did not survive. They were screaming for their mom in the middle of it. And I've taken care of them for 9 months. That was my day. And they're like, oh,
right. We sit in our cars and we decompress and our
you know what I
spouses are like, why are you home like an hour and a half late? Right. That was always what I dealt with. And it was like, because I can't bring this home. I need to like bring it down, go to the gym, work out. But I got to just, especially when you go 12 hours, people do not understand there is no privacy in a hospital. The only place you have any moment of silence maybe is if there's like a solo bathroom, maybe. Right. And those are always locked for some reason. Right. So again, we don't have any space to like have a minute in 12 hours or 16 hours. Right.
And I feel like no one teaches that. Like, why don't we have a whole class in nursing school and of how to like address it and how to realize like, hey, here's some like coping skills. I also think like therapy needs to be a thing. Like we've been talking about, like it can be so helpful, but it's so expensive, like so expensive. And it can be hard to find it even if you do have someone. And then sometimes like I've had things where even like going to therapy, the therapist it was just not a good fit. You know what I mean? Like you could just tell you were like, they're not.
I tell people that all the time because I recommend therapy to people.
Yeah.
Not everybody necessarily, but a lot of people. I'm like, you know what? Well, my sister's going through a lot. So I've been telling her, gosh, you would benefit so much from a therapist. And I've talked to people that are like, yeah, I tried it. It didn't work. I'm like, no, you don't understand. There are so many different approaches to therapy, like flavors of psychotherapy. And then you have all the individual therapists and they're people. And some of them are good at their jobs and some of them aren't. And I've had bad therapists. I've been a one and done. And like, this person is not going to get me. I've been with my therapist now for a year and a half, maybe 2 years. He is amazing. He understands, he listens, he draws, he'll connect the dots with things in my life. I'm like, I never thought of it that way. And that's when you know you have a good therapist, when you walk away going, I never thought of it like that. He helps you to grow. So if you're frustrated, if you're trying to find a therapist, keep looking, because you'll find someone that you click with. You're like, oh my God, they get me, and it'll be amazing. But it's a long road sometimes.
And I think Captain Aiko said, I experienced my first patient passing. I couldn't believe they still had to pass meds like nothing happened. That's a weird thing that we do at our jobs. Like that's very odd that you would see that. And that most people, like if someone died at my husband's job, everyone would go home. That would just be like, okay, you have the rest of the week off. I am so sorry. Like, and we literally had the same prep, which was 0 of how to handle that. You know what I mean? Like
I've said before, at least for emergency nursing, maybe for nursing in general, if you're going to last more than a week, you need to not only give lip service to the fact that death is a normal part, is a normal part of life. You have to have a deep conviction that death is a natural part of life. And when you see it, you're not like, this is out of the ordinary. This should never have happened. It absolutely should have happened. It's going to happen to all of us. And if you don't internalize that and hold that deeply, you're going to have, reactions like that. Like, I'm supposed to go past meds. Well, I understand where you're coming from, but in another way, it's like people die all the time. And the first time is hard. The first time for sure is hard. But after a while,
I think it stays hard.
You have to develop.
But it gets different, but it
gets different. Yes.
Yeah.
I work at a place where it's pretty, I think it's because it's a teaching hospital, but we have things called respite rooms which is just like a room with a massage chair and some essential oils and lotions and stuff. And like the people write affirmations and like put them in a little cup. You can go read them if you just need a minute. I don't know if other hospitals have this. My hospital has it. It's not on all the units, but
that sounds like a very good idea to just go have a minute.
A lot of hospitals have a chapel, and there's not a cross at the front. There's not a Torah at the front. It's usually some flowers, maybe a candle. And sometimes there's a book like that where people will write, their thoughts. And it's just sometimes a quiet place to go eat your lunch real fast and then go sit there for a few minutes before you have to go back. That
was not what a lot of people at my hospital used the chapel for, Scott. But I'm very glad yours used it.
I want to hear those stories. It sounds like after.
But yeah. And Karen brought up a good point, like veterans at the VA have the VA to assist with PTSD. I mean, I don't think they probably do a great job because we all know how that goes. Woefully inadequate, but it's better than nothing. Who's going to be there to take care of our health co heroes, and what measures are in place? Do any of your hospitals have anything in terms of like mental health? I know mine didn't. They were just kind of like, you should color. Here's a coloring page. And we were like,
we have an employee assistance program, which many
have that too.
have utilized. I personally utilized, and most places it's a free service for, 5 or 6 visits. They'll plug you in with someone. I agree with the others. It is very hard to find a practitioner right now. You're gonna have to wait it out, have some coping strategies in place. But I think the point you brought up, Scott, was interesting, that as a nurse, you kind of have to get particularly if you're working in a high acuity place like the hospital, pretty much anywhere in the hospital, death is a part of it. And you just got to get used to it. But these baby nurses that came out during the pandemic, this was unlike anything. This is not the norm, I experienced some ER time. I experienced some ICU time, and 4 or 5 deaths in a day with a patient who's gasping for breath, telling you, please save me. And they're 35 years old and their 13-year-old is sobbing in the hallway. That's not the typical. That's like a mass casualty incident every single day for 2 straight years that these very new and green nurses had to experience and learn how to cope with very quickly. So it was very outside the norm, and hopefully something we will never again see in our careers or lifetimes. But I think that is its own category of stress to deal with versus the normal, like I'm going into hospital work because I'm drawn to that kind of work. And I understand that there are going to be traumas that come in, but it's typically in 1s and 2s. It's a bad day when you have somebody who falls off a ladder and has a brain bleed, and then you have a family who's screaming at you, and it makes for a bad day. But when it's like 5 and 10 of them a day and they're stacking up, that's I think where the burnout piece of the pandemic feeds into it. But clearly there is a broken system that was in place long before this started with nursing in regards to safe staffing and all of the things that we put nursing through. And physicians, to me, I work with graduate medical education residents every day. Their office is right next to me. And to me, their training, like this is why physicians commit suicide. It is astronomical. We've proven now that nurse practitioners can get out there with less training, less years of education, and be just as effective, and in some cases more effective and more cost effective. So why do we have to put these kids through this, and then you pile onto that some of the cultural beliefs that these kids are put into. They come from families that you are nothing if you're not a doctor or a lawyer. So then you go to school, you have $400,000 of debt. You get out of school, you're stuck in one specialty. And if you don't like it, oh, well, because you have a lot of debt. To me, that's a whole separate problem than like what nurses and bedside staff go through. And then the pandemic is its own thing. So it's like all these subset of problems that just fed onto itself and became a dog pile during the pandemic. It's pretty horrific.
Yep. And I'm glad you pointed out like the pandemic making it so much worse, because that is a subset of something that was already bad. And then this just like catastrophized it. So if you're feeling like this is impossible, it's not always like this. And like, I think every area struggled during the pandemic, but I can't even imagine inpatient. I mean, outpatient, it was hard enough. So like,
I'm sure
if you're entering it now, like if this was when you entered it, like it's not always like this, you know what I mean? And kind of knowing that. And then it adds on nurse nader. So I feel like many hospitals didn't even care about stretching a sin during COVID because their destiny wouldn't change with better ratio, but we couldn't provide dignified passing, and that hurt. And I think that's a huge part of it too, is you couldn't even feel like you did your job well. At least I felt like I couldn't do my job well because I had no idea what was happening. You know what I mean? Like we didn't know, there was no time. Everything was rushed in outpatient, we didn't know if we were getting paid for what we were doing. We didn't know if we were doing the right thing. Am I going to get sued for recommending this when, like just all of that, like, because who knows if this is even helpful. So that's cutting into my time from being able to treat my other patients well. And I was stressed. I was frazzled. I was not being the normal, like, oh, let me sit down and like really hear you out. I was just like, somebody just coughed in my face after lying to me that they didn't have COVID symptoms. And I'm freaking out. So I'm being snippy with, you know what I mean? Like, so that's nothing like inpatient, but at the same time, everyone was affected this way. And you felt like you couldn't even do the job that you were stressed at well, which is like one thing that like a lot of people prided themselves on. And I wanted to also mention, because Bree brought it up, that residents, that I would never go to med school because of residency. So they're working 80-hour weeks. And I think this is something that we really need to like change, even though this isn't within nursing. And I think most of us are nurses. I think this is something we could advocate for, would be a change in how we train physicians and just make people aware how barbaric it is. So you're working like 80-hour weeks, which is a lot of hours. You are they polled medical students and residents, and they were pretty much 10% of them had suicidal ideation in the last 2 weeks. And if you are a medical student or a resident, you're 3 to 4 times more likely than your peers to clock out. That's huge. And that's horrifying. Like, why? And why haven't the AMA and everyone looked at that and been like, oh, like, we should probably change that. When I worked inpatient, there was a old building attached to our building. And every year, like, I would say 3 or 4 residents and 2 or 3 nurses would go over there to clock out every year. And it was just normal. They were like, oh, it happened again. Be careful when you go over there. Please don't do this. Reach out to HR if you're feeling sad. I'm like, that's our solution, is to like, and it's happening because you're exhausted and you don't feel like you have a way out, right? You have all of this debt, nurses and physicians included. Nurses, it's less debt, but it's like, I think for a lot of nurses, it's like, I hate this job that I worked so hard to get to. I don't even know what else I would do. I can't quit because my family needs me. And with med students, you have $200,000 worth of debt. So you're like,
at least, yeah.
And you're exhausted, and you're alone at night, because we put interns on night shift by themselves. And then we're like, hey, go, here's your 40 patients. If you mess up in the morning, your attending's going to scream at you. Like, good luck. I want you to do that 80 hours a week. You won't have your family. You're in a weird city. You didn't pick because the match randomly threw you here. You're not even in this rotation because you want to be a pediatrician, but you have to do a whole year of random crap first. Like, just a mess. So it's very, very real. If you're feeling like that, I kind of just wanted to drive that home. Like, it's not just you, and you will probably feel like you're being like, something is wrong with you, but nothing is wrong with you. Scott, and then I want to just go over like different coping mechanisms that we have all found.
You talked about the stress that the residents are under, and it reminded me, I wanted to share this somewhere in the video, and this seems like a good place. I was really surprised when I was studying this kind of stuff to realize there is a formula for the S word, the final checkout. And that is psychic pain. There are ingredients. Psychic pain, which can be like, I'm not able to do my job. I'm not living up to my parents' expectations to be a doctor or a lawyer, any of those, or, death all around me, or whatever the or a mental illness like, depression, but perceived psychic pain, deep psychic pain, with no hope of it ever ending. Mm-hmm. It's one thing to have psychic pain and go, look, I'm on medication, give it 2 weeks, and then it should be getting better. Then you can but people that are convinced there's no hope of this ever getting better, and I'm in such pain, that is SI, the S ideation, okay, mm-hmm. Clocking out ideation. Add to that impulsivity and access to lethal means, and that's the recipe for a completed final checkout. Mm-hmm. So when you talk about interventions, you can intervene anywhere, like try to avoid people having psychic pain in the first place. Try to give them hope that the universal need of people in crisis is hope. If you can give them hope that it's going to end, that will break this formula. If you're not an impulsive person, I've been severely depressed. I don't mind sharing because I want to destigmatize mental illness. I've been wanting to check out, and I think the only thing, and being a nurse, I knew how to do it. Mm-hmm. The only thing saving me was the ingredient of impulsivity. I'm not an impulsive person. I sit there for 15 minutes to pick out a candy bar at the gas station. So I am not an impulsive person. Had I been, I could have probably gone through with it. And then access to lethal means. If we don't have firearms in the house that our young people can get into, things like that. Any of those places we can intervene to save someone's life.
Mm-hmm. And lack of sleep too. Like that's
part of the psychic pain. Sure.
Not being able, Scott, I'm very glad you're not impulsive. I'm very glad.
Me too. I'm glad to be here.
I'm very glad. And Nurse Nader says healthcare workers have knowledge of how to do it, access and trauma, and it's a perfect recipe. And it's something that has taken a lot, which is why there's a lot of different, I have left some, like a few resources down below before we start sharing kind of like what we've all found sort of helpful, because you're going to find something that's helpful for you individually that might not be like everyone's cup of tea. Like Scott, it sounds like does well with like compartmentalizing. We're going to try to also avoid using other substances because nurses in particular, and we drink a lot. Like a lot. I have gone through different bouts of falling into that. As a nurse practitioner, I did it more than as a nurse because I worked night shift and I was usually asleep before I could do anything. But as an NP coming home and being like, oh, like a glass of wine or two, a beer or two, because my day was crappy. Nurses drink a lot. We drink a lot to cope with things. This is a great website. I left it down below. Don't Clock Out. It's all around a nurse who did clock out due to stress and just everything related to the pandemic. They have a lot of resources. There's also some other things that I'll end up putting down there, but they changed the hotline in case you are looking for any resources. Now there's no longer the SI hotline. Now it's just 988. And they have an online chat.
There's actually both. I tried, when I did my video on that, I tried calling 988 and I couldn't get through. It said, your phone's not set up for international calling. Or
weird.
Yeah.
When did you
do
it?
The old number still works.
Perfect. Perfect. And they have an online chat now too, which I think is super accessible. You can text, which I know is easier sometimes to text it than to actually say it out loud. I know I was having horrible issues with this, like not related to healthcare, but like after I had a baby and I couldn't even say it, I had to write it. And so I think acknowledge, like, however you need to do it that way. Bridget, do you want to share any way that you coped with either burnout or like struggles, really like mental health type stuff in a proactive way?
So I have ADHD. I'm impulsive, and I think part of it is knowing yourself, knowing thyself. Mm-hmm. And I have a lot of empathy too. So I would love to be how Nurse Scott said, that he can say, this is the part of job, this is normal, let's just deal with it, move on. And knowing thyself. So Scott mentioned the recipe for clocking out, and I'm impulsive, right? Also part of it is that helplessness, the healthcare system, even way before the P, it felt pretty hopeless. It feels like we're going to always be understaffed. So at that point in time, I had to do some self-reflection, and I have almost like I don't know what it is, a hero complex. I want to help. I want to change the world. I'm an idealist, right? But I couldn't, right? I tried to, on the unit, I would talk to my nurse manager. I would provide studies. These are the outcomes for every additional patient you give a nurse. And when you see that things aren't changing, that's the time where you have to put on that oxygen mask yourself and look out for yourself. So I had to take a step back and just tell myself, I can't stay in bedside because it is literally going to, kill me. So, how I coped when I was in it is through exercise. I have a family history of substance abuse, so I refrain from any drinking for that reason. I don't want to trigger anything. So a lot of exercise, yoga, meditation support system. And then finally, when I realized I can't stay in this profession because I also teach right now, and it hurts me when students don't have the empathy for patients, right? It's not the patient's fault. So if you're ever in a situation where you feel, I'm at the point where I don't care about patients anymore, or that's not coping. That's not coping either. it's treating patients as if they're just a number. So that's why I decided to go back to school. And at first I thought I just wanted to do education. So I went back to school for nurse educator. And when I was in that, we actually did have to shadow an NP, and I found a passion for family practice. So I went back to school, and yes, and Carla's comment, and education is so rewarding. So find that niche. If you're in a spot where you are burned out and it's harming you physically, mentally, find somewhere else. You can always work somewhere else. There's so many options with the nursing. So those were my main coping ways of coping, was exercise and just removing myself from a situation that wasn't going to change because it was helpless and hopeless at that time.
Thank you. My sister and I were just talking about how you have the most calming voice ever. We were like, wow, this is like excellent. We love Bridget's voice. But I think that's really good advice of that. And two, to realize you can change your mind, like, and that's totally okay to get yourself in a situation. And I think with all of this, just like Scott was saying, the permanency of feeling overwhelmed and like there is no exit, there is always a different path, right? It is okay to change your mind no matter how deep you are into something. It is figure outable. It might not feel figure outable right now, but in about a month, it probably will feel more figure outable. It is figure outable. It's okay to change your mind. We've all changed our minds on pretty epic things. I spent a whole lot of money to do it. I am not doing anymore. And we're going to figure it out. Like, it's going to be okay. Nia, do you have any tips? I know you were saying you have a lot of things that you do in terms of helping prevent like burnout and just dealing with all of that.
Yeah. And I would say, just from the perspective of someone that's like going into school, or you're about to finish or something like that, and you're thinking about taking your first job, the things that I thought about when I took my job was that some jobs have like the minimum hour requirements to like be full-time. And I would say pick that, whatever that is. You can always pick up extra. When you pick up extra, you're going to get the premium pay. And so you can, for the most part, work as many hours as you want. But when you need that break, it's built in. For my hospital, it was 32 hours. So I'm a 32-hour employee. And it's been so helpful so many times to be like, this is my 8-hour day. I can do this. This is my 8-hour day. I can do anything for 4 hours, and I'm in float pool. So when they pull me, it's like my day just started over again. And I think being in float pool for me has been like very, very, very helpful, because I get put in the psych hospital sometimes, and being with SI people, they say whoever you spend the most time around is who you're going to be most like. And sometimes during that period of the P, I was with a lot of people who were SI, and it was people in my personal life, let me know like, hey, you're changing, you're different. And please don't talk about work with me anymore. Oh. And so, so that was difficult. And, so definitely that's my big one, is if you have flexible hours, take the minimum and then build yourself up. And also, if you're like a lot of people that are in this industry, you love overtime, you work every day, you work all the holidays. I had so many hours built up for vacation that they told me I was going to lose them all. And so I had to use them. And then I needed a surgery, and I needed 6 weeks off. And I had to move. And so I wasn't like resting or on some beach for 6 weeks, but I still can't like overstate how important it was to just like be at home.
Use your PTO.
And like actually use the PTO for PTO. And like it doesn't have to be some glamorous thing. And I feel like that stresses people out too, that like I wasted my PTO to like go on a hike. Like, no.
Like, I want to applaud you, Nia, for that, because one thing, I mean, from my union background, I would always tell workers, and I've continually tell people, make sure you understand your PTO and your sick time and if there's any difference, because you cannot cash it all out. But if you just go off sick and you don't come back to work, they're going to have you use all that time. And a lot of people leave a lot of money on the table in their jobs that they've earned and they'll quit, they'll resign, they'll leave. Maybe they'll, they may leave a couple 100 hours. That could be, a few months of pay.
What?
And
It is.
and I would tell people, just go off sick and don't come back. They can't do anything to you. They're just going to have to keep paying you.
Yeah, and there's people at my hospital who, they're immigrants, and so when when family members passed away during this period, people just went home for 8 weeks. They're just like,
Wow.
I'm leaving,
Mhm.
and I have all this time, so
Yeah.
see ya, and I'm out. And they're gonna want you to come back.
We
Yeah.
convince ourselves though, like, oh, I shouldn't do that to the company or this or that. Well, you earned that time.
Yeah.
You earned it.
It's not
Mhm.
personal to them. Look, they hire travel. There's all these.
Mhm.
They have a bunch of backup plans on backup plans on backup plans.
Or if
But you
not,
don't.
it's still not our
And it's not your
problem because
problem.
And even if
we're
they're
not.
not prepared, they're not prepared.
It's
Yeah.
not our name on the paycheck, right? I mean,
No.
ultimately, that's the leash that they have on us, is this codependent kind of thinking that I'm the one responsible for the care of the patient. No, I'm not. The
Yeah.
Only
hospital
while
is
you're
responsible
clocked
for the
in.
care of the patient. That's why they have a license to operate as a healthcare facility or a clinic or whatever kind of facility they are, right?
Mhm.
Unless you're a private physician or private provider and you're licensed in your practice. But no staff, no employee has the burden of the hospital operations.
Or your unit either. I feel like they trick you into the family thing a lot, where they're like, your unit is your family. Like, if you call out or can't come in, like, we would love to be able to, like, oh, you're calling in, but like, what's your reason? Oh, you're letting your family down. If you don't pick up this extra shift, your friends need you. Like, there was a lot of that where I
There's a
came
lot of
from.
that.
I don't
And
talk to anybody in my family,
I know.
and so I'm like, I don't have any. It's me, my dog, right? I
Yeah.
mean, it's like one thing I would tell people is like, it's not personal. And we had a very tight team for 12 years.
Mhm.
I mean, when I say we were cohesive in the whole hospital, tight group of people. But I'm like, it's not personal, right?
Yeah.
I'm not sleeping with you. I'm not eating at your table. Well, sometimes I am, but
Mhm.
it's like, we're not, like, we have to separate it. But it's like,
Yeah.
we all respected that. But when managers would come in with
Mhm.
that garbage, we would just be like, yeah, no, not
Yep.
happening.
I used
We
to
would
get-
respect each other. We would push each other and say, oh, will you please work overtime, double time, blah, blah, blah. Okay, yeah, I'll do it. But if we said no, there was respect. It was like,
Mhm.
we're not going to trip out on you about it.
Mhm.
I used
Sorry,
to get
Scott.
so mad. We had to call in sick or call in not coming in, whatever it was, to the staffing office, which had workers that just worked in the staffing office. And I would call and say, hi, this is Scott. I work in the ER. I'm going to need to call in for my 3 to 11 shift or whatever. And they're like, okay, I'll put you down. And I'm like, no. Don't give me the whole side, because first of all, this is your job. You come into work to take sick calls. This is your job. Yes, I just made more work for you because now you have to find someone to cover my shift. That's also your job.
Mhm.
And, I'm so glad they stopped asking us, well, why are you calling in? Because
You
either
never
I'm
have
not,
to say.
because I'm not, if I'm not, and they've stopped doing it. But I always thought, look, either I'm sick and you're just like getting on my nerves. I need to go lay down, or I'm not sick and you're going to force me to lie. So it doesn't really get either of us anywhere. But some of that is built into the system, this whole, heavy sighing when you call in sick garbage.
Oh,
It
yeah.
I
just
think
kills
it's also
us.
why are you calling in sick, which you're not required to do.
We're
You don't
not
have to
required
tell
to
us.
answer that
That's none
question.
of their business. That's
None
your
yet.
private information. The
None
other
yet.
thing I would say, as far as self-care, we're talking a little more tactics about care, is do not start answering your phone and texting
Yeah.
with your manager. If there is literally one thing I could tell anybody that's starting in any job, do not respond outside of work hours to a
Right.
text message or a phone call unless you are being paid to be on call. Period.
Leave me a voicemail and I'll check it later.
And do not ever answer an email
No.
after work hours. I mean, we would literally, I can tell you, I didn't even go to a staff development for the last 9 years. I worked at the hospital because I was like, you're not giving me the time off. I'm not doing it outside of my 36 hours. And they would be like, well, you got to read your email. You don't give me any time to read my email. So go ahead. What are you going to do? I mean, we just literally boycotted en masse in the whole hospital. on that. And we were like, yeah, we're not doing staff developments. We're not doing any of this. We're not doing education modules while we're at work. Also, do not ever, as a nurse, do education modules while you are on the clock with a patient assignment. That is another fast track to kiss your license goodbye and add a lot of stress on yourself, because there's a record that you're stamped in on that module. And if something goes down with your patient at that time that you're stamped in to some module that has nothing to do with the job you're being paid to do, they need to pay you additional to do that overtime, or bring somebody in for 4 hours, which we eventually got our hospital to do. We were like, bring travelers in. Great. I'll sit at the computer for 4 hours. They can finish my shift, right? Because if you get stuck, because I did informatics, and you get stuck and something happens, again, this is self-care techniques. Think ahead. We have to start thinking ahead about self-care, and like building in the self-care into how we operate, right? And those are a couple of things I would suggest to people watching, or think about, or, really, especially when you've got a license, because if something goes down and they've got you logged in on a class, and you're not even, and they could show you've been logged in moving that cursor for 30, 40 minutes, and then you somehow documented that you saw the patient, oh, it's over. It's over. Just $20,000 for a lawyer right there.
That's a really good point.
I think that planning ahead, like you just said, is a really big theme, like that I have found is really helpful. So if you know that it's stressful all the time, but it's just like, when you're putting out your schedule and everything like that, I don't know how advanced everyone's is, but it's always a few weeks out at least. Plan your concerts and your birthdays and all that stuff ahead of time. And then you just, like, your requests are around that, instead of being like, sorry, friends and family, every single time, can't make it to whatever because the hospital needs me. When again, we should be thinking about our jobs as in a corporate mindset, just like how they're in a corporate mindset when they're asking us to come, but then they add on that extra social manipulation layer. Just skip the social manipulation part and stick to the facts. If you're a facts-oriented person, they can't argue with you. If you know all the rules, they can't argue with you. I mean, they can try, but you will have like a solid footing and knowing like exactly right. Like someone could tell you like, oh, it's okay. Just go do that class. I can cover your people or whatever, but that verbal is not anything legally.
And if you have friends that work in other jobs, ask them how it's handled at their job, because I didn't know until one day I was doing modules at home, which don't do that. You don't have to do that. And my husband was like, don't you have an in-service day? Like most jobs have a day where you just do all the crap. Like now I have to go renew my license and do different things. So I just said, hey, I'm going to need a couple of days to renew my license, do this. Nurse practitioner jobs are a lot better about this. You have like days where you're like, hey, I'm just going to need some time to like do this, negotiate that in case you are looking for an NP job, negotiate that into there so you can have like CEU days. But I just like that never even occurred to me. He's like, that's weird. Don't do that on your own time. Like, don't do that. So ask your friends, ask your family who have more corporate type jobs. Do you eat lunch? Okay. And you can pee twice in 12 hours. Wow. Okay. You do all your learning modules at work. Like, and that will just give you a better idea of what's normal, because corporate America is very different. Also, I just wanted to put this up here. Corky's worried. Is anyone here like being a bedside nurse, signed a concerned patient? Let them know. And what the benefits are. I saw later they were like, oh, what are the benefits? There we go. Okay, perfect, Vanessa. Tell us what you like.
So you guys can probably tell I'm a very shy person. I always knew I wanted to be a nurse, but I didn't really know how I was going to be a nurse. I have found that once I got into my role and found a specialty that I like and I love, I probably talk the most at work than I have in my whole life. It really just opens me up. If you love what you're doing, it makes it so much easier. And just getting to know the patients, knowing that you can take care of them and you're doing the right thing, that's what helps me. That's what makes me feel good about the work that I do. So it's all about, in my opinion, finding the specialty that you love, and that you're passionate about. And then also just after your shift, separating yourself, leave whatever happened at work, and find something to enjoy your time off with your family, your friends, your pets, whatever that may be for you.
I love
And
that.
we've said on another video, you know, so many of I think it was the "Would you do it all over again if you had it to do over again" video. So many of us said we love nursing. We hate working at a hospital. You know, we hate the administration and that garbage. Taking care of patients is amazing, and I think a lot of us, yes. When if you're a patient, your nurse probably really wants to be there and help you, and is probably also very frustrated that he or she can't do it as well as he or she wants to.
Yeah, that's the big frustration, is like you have these ideas about what you're about to provide, and then there's all these other demands, and it makes it so that you have to make hard choices and say no to things that you want to do for the patient, because it's not necessarily what you're getting, I guess, graded on. Like, I don't know what
Yeah,
to call
that's
that.
not something you're going to get repaid for. Like, the hospital doesn't see that as a billable, worth your time type of thing.
And it's like you have to kind of please that first, or else you won't get to do it again. So there's that. I think also a part of like outside of work and shutting off, I do have like a rule with my friends and family that I don't really discuss like work problems, and that's where like EAP or people or coworkers comes in handy. And like my group, I'm in float pool, so we don't really like see each other all the time, but we've been doing more like socials, just so that where it's like not a bash work kind of thing. It's just let's just do physical activity. And I found that people who have hobbies, physical hobbies more than sit down and let your brain go somewhere else hobbies, are doing much better than the people who don't have anything else to live for outside of this kind of work.
And if you realize you don't have hobbies, that's also, I found a pretty good indicator that like something may be going on, that we need to look a little bit deeper. You know, especially if it's not like, oh, I'm just like, you know, some people don't have time, like reasonably, they're working 3 jobs, you know, they're the sole income earner, whatever. Like, but if you have any spare time and you're like, oh, what do you enjoy doing? That was a huge trigger for like thing that I realized like, oh, something is not right here, because I was like, I don't enjoy anything. Like, I don't do any hobbies. But I totally agree. I think going outside, like gardening, someone earlier had said like just walking.
Yeah, just like, walking. Literally for me, I realized I hadn't laughed in a really long time, and I didn't know, like someone was like, tell me a joke, like one of the patients. And I was like, I don't know any jokes. Like, I didn't say it like that to them, but it was just like in my head, I'm like, oh my God, I don't know any jokes. Like, I can't even tell a joke. I can't even make up a corny one.
Yeah.
And then I was like, my goal for, I think it was in 2020. I think my goal was to laugh more with like in real life, and not at like a comedy show or something like that. But that was to like, I want to find my sense of humor, because I found nothing funny.
And that's an important stress response, right? In healthcare, we laugh, we joke about things, inappropriate things. But during the pandemic, I mean, those peak periods, there wasn't anything funny. There wasn't anything, there wasn't even the space. It wasn't, that was, I think that in itself became a moral injury for a lot of people. Because even that one bit, right, Nia, it's like we couldn't even laugh at the crazy things that we would laugh at, But I think, so I think that's
because it used to be breaking the ice with the patient was like a part of something that I think is a requirement when you walk in. And then when that just wasn't happening, and they don't have their friends and family there, they're not allowed, we're all in masks, we don't see each other. And you're like, and me personally, my voice doesn't carry very much, and people don't understand me as much. And when I'm stressed, I tend to just be I'm just going to do the thing that's the most beneficial, I guess you could say. Like, I'll show you rather than tell you. And so I wasn't really speaking a lot. But then also they couldn't see if I was smiling at them. And I'd be smiling at people, and I'd be like, I am smiling at you under this mask. Like, I'm still doing it. I know you can't see me, but I do care.
But we're here.
There's a whole dehumanization part that happened as well, which is because of the masking, because of, you couldn't see people, they couldn't see your face. It was like, did your expression even matter? It really, because we're human, right? We read cues, we read faces. That is something, especially as nurses, healthcare workers, we're very good at doing. It's like that look where that patient's about to code, and you see that look from your coworker, and you're running to the crash cart, right? You know, to just seeing your patient, being able to read them, their family. You know, I wanted to just share about, like, this is a very interesting research because we have so many travelers and so many young nurses coming in. You know, one thing I get very concerned about is seeing that all these travel assignments are requiring 4-day work week. And are we normalizing now a 48-hour work week? Is that right? 36? Yeah. 48 hours. So are we normalizing that? One, I think that's a huge problem. I really, if I could say one thing to travelers, stop that. Just don't do it. Don't take it. And because, you know, like,
I've been declining all of them, and I've been telling all of my friends as well, like, don't take it, because I want to have the
it's not even
option
good
to
money.
pick up that shift. Right. Like,
Not even
let
good
me
money.
make the choice. Don't make me sign up to do 48 hours every week. No.
No, it's not healthy. And, you know, in this research that I was reading, 34% of people, the nurses said that they were emotionally exhausted, right? What was interesting is that the main risk factors that increase nurses burnout were the following: younger age, so under 35, decreased social support, low family and colleague readiness to cope with the pandemic, increased threat of being personally affected, longer working times, right? Working in a high risk environment, and working in hospitals with adequate and sufficient material and human resources, which also means staffing, right? So again, if you're going to work 4 days a week now, and you're going to have 8 patients or 10 patients, I mean, these ratios are, they're not even ratios. Increased workload and lower level of specialized training, right? So those are the really high risk factors for burnout. And so if we reverse engineer that, if people think about that and how to reverse engineer that, we really have to start setting boundaries, you know. And, you know, of course, I'm a big advocate of unionization, right? Because it does it's the minimum. It sets a minimum. It's not the max. It just sets the minimum, whether it's requesting time off and there's an orderly manner to do that, whether it's, you know, what shift you work, getting promotions, being able to transfer out. Because I hear all the time about people that are being, you know, stymied and not able to transfer into other departments, and they're basically being trapped in their department, right? Well, of course, people, what are they going to do? They're just going to quit if you do that to them. So again, we're not seeing the hospitals responding and healthcare responding in a positive way. So I think that, you know, people really need to be aware of that mismatch. If you're feeling that mismatch of your role and your job and then the resources, and it's not jiving, you got to go. You got to, you know, save yourself first, because don't let yourself get to that point anymore. Do what you need to do to recover, like a lot of us are, and just taking time off and, I don't know, living off our savings, you know, or whatever we can, because we just have to. It's like our life, you know, because we got to think about the long haul. We're going to work another 20 years or 30 years or even longer.
And you are worth it.
Right.
Like,
and
always worth it. And there are other jobs too. Like, I feel like
I just don't see this traveling 4 days a week thing being sustainable for people. And then what's going to happen? The healthcare industry is going to get used to that. That's going to become the norm. No, because then they're going to change all the overtime law. I mean, there's a lot of other things about that are behind the scenes at work with the healthcare, with government, you know, the big business, to take away overtime laws, change and reframe overtime laws. That is not healthy. We already know the 12-hour shift is questionable, but working 4 does not give you the kind of balance, especially on night shifts.
No,
Definitely not on nights.
No. And I would say, like, the big thing here is just like Montana Gal said, 12 hours is enough. And that's what I used to tell all my orientees. Do not take overtime. Like, I know it's appealing. I know it's whatever. If you need to make extra money, literally go do it somewhere else. You could work as a nurse somewhere else doing something fun. Like, if you want to go do like aesthetic, like something fun or different, or like literally you could do anything. Like, I wish instead of picking up bartending, or instead of doing nursing, I had just gone back to bartending, which I had done for a night or two. Something different, something fun. Go be a nanny. People are going to pay you out the behind to be a nanny if you're like,
even home health. Home health is super chill.
Yeah.
It's just super chill.
And also, Merce Cal, thank you so much for the super chat.
I teach, you know, I taught CNAs for a while. It was great. I loved it. It was like weekends, you know. I mean, I remember doing H1N1 when I first started. I worked 24 days in a row. And then I worked like in 2 months, in January and February, I worked 24 days in a row, and then I think I did 27 days in a row. And some of those were 20-hour shifts. Sometimes I slept at the hospital and just took a nap. And was that good? No, it was not good. You know, it was what I did as a new nurse, because I was 4 months in and I thought, oh, well, this is what we have to do. But, you know, there wasn't anybody advocating for us. And I think now in the realm of social media, there's so many more of us advocating for each other, advocating for other nurses, for nursing students, advocating for our rights and our wellness and our mental health, you know, and we just have to keep pushing on it. And hopefully people will continue to be receptive, right? It's like, go do whatever you need to do to go make money, but take care of yourself. The exercise, the social structure, having a social life, traveling, stimulation, you know, trying new exercises. I'm doing Pilates now. It hurts like heck, but it's changing. Yeah, it's great. But it, you know, it's like I had to do something different. So I swam, I do Pilates, like do something else, you know, try something new, learn a new language, right? Those are self-care techniques. And get a trauma-informed therapist. I'm going to say this. Also, your EAP programs are not confidential. They can't, you do not have privacy with EAP. I can guarantee you.
Employee assistance programs.
Employee assistant programs do not guarantee privacy. They're going to tell you that in the fine print. If you read the fine print, it's going to say that. They're going to tell you somewhere in that fine print they are not confidential. So they can be helpful, they can be useful, but your employer will know if you've gone. They know who you see, they know what you're there for.
I don't love that.
No,
I don't love that at all.
So again, it's a system. It's a system. It's a system that doesn't serve. Again, EAP is like, you know, it's a mixed bag. So I have a lot of thoughts about EAP. But get a trauma-informed therapist. Find somebody and get into trauma work and specific training, because that is what most of us are dealing with, is some level of PTSD. You cannot. An average therapist is not equipped to handle that whatsoever.
That's a great point.
And I put a lot of resources in the chat for different healthcare, mental health services, some articles if people want to write a paper.
Oh, good. Rachel, can you capture those?
So I dropped some in there. So
perfect. Second opinion. If you go through and capture those, that would be a delight, because Adrian knows all the things. And Merce Cal, thank you for the super chat. He's coming in with all of his sage encouragement. Pets help. Pets do help. Pets also give you, I mean, this is sad, like, but there's someone, like, if you are on that bridge of like the clock out bridge, it is someone that needs you. Right. And so that is usually something that you're like, well, what am I going to do about my dog? And I've had many patients who have come to me actively having thoughts of wanting to clock out, having a plan, having a way to do it. And they said, I won't do it because of my dog or my cat. And like, I don't know what they would do. Having a dog, routine exercise is anything where you're moving your body, friends. It doesn't have to be hardcore. You don't have to be Adrian doing Pilates. When I did Pilates once, I couldn't even get off the toilet. I was like stuck. I was like, I'm down. I do not have the physical strength to get up off of this thing. Any kind, walking, perfect. Schedule crazy weeks and down weeks. Take weeks off, like Nia was saying, and just have a staycation. People are like, what are you doing? You're like, I am watching a crap ton of Netflix. A whole lot of it. Like, and I'm sitting here and I'm playing games on my phone. Thank you. And I will walk outside once a day. Talk therapy, fetching helps. Taking care of yourself at work. Yes. Hydrate, pee, etc. If you aren't getting things done and they're like, why didn't you get this done? You're like, well, I was peeing. Heaven forbid.
Then when you're that honest, people are just like, yeah, I'm going to leave you alone.
Yeah. They're like, whoa. Where were you? Exactly. Where were you? Oh, I was pooping. Oh, okay.
Honesty is the best policy. I love these, Merce Cal.
Yeah, I know.
He's the ones that are on my list here. And I was going to say also, like, buy that fancy water bottle if it makes you drink. Like, just the fact that you have it with you and you're like, okay, well, I'm going to drink then. And also protein shakes in the morning, like protein in your smoothie. I don't know, but it works. I think it's because you are full from like actual macronutrients, but if you put the spinach and things in there, you get the micronutrients too. So you don't have to be, you're not like, I can't wait till I can eat something. You're not thinking that. You're just
very healthy.
And so if you drink the water before that, then you're really full once the protein expands in your stomach. So at first you might be like stuffed at the beginning of the shift, but like, you're not like, oh my God, I can't wait till I can eat. I can't see anybody else until I just have a snack. Like, You don't have
And
that.
you can be really healthy like Nia and put vegetables in your protein shake, which sounds amazing. Or you can go to Costco and you can get the caramel flavored protein shakes, and then you pour coffee into it and it tastes like a
Yes.
caramel macchiato.
I
It has
learned
like
that.
zero nutrition, but it's delicious.
You could do
And
that, or you could do the healthy version of that.
see,
which
and
is-
then there's things called vegetables. I hear they're great.
There's a really good, if you like the coffee flavor, you can put like a nut butter and then like the powdered like instant coffee in your smoothie that they blend really nicely, so you're not getting like the grittiness, but you still get the caffeine. And you know, if you want to add that caramel syrup, say add it. I like to eat the sugar and have like a dessert all the time, but then I also work out.
So you mean you don't just put the like instant pack just in your mouth? Like,
No,
yeah,
Use it like
I
a
want
fun
to
dip.
be.
like we would do when I would be hiking.
Yeah.
Just be on a march or like just
I mean,
or
I've
the,
done
or the
it.
emergency, just straight in and then chase it with water.
I have done the emergency that way. A lot.
Yeah.
Very fun. Cal also says, remember your effing awesome-ish you do. Stay in touch with your friends and family. Yes.
Yeah.
You are
Yes.
effing awesome. Don't stay in touch with your family if they're the worst, though.
Yeah.
Or friends. You get to pick your people.
No.
Bree, I'm going to pick on you because you've been quiet. Tips for even particularly inpatient.
Well, I don't know. I mean, at points when things were so bad and census was bad, sometimes even getting through the shift was very difficult. And I do find that to be true in a lot of the nurses, the overwhelm when they're tripled and they have multiple devices, that's really unsafe. And how do you keep going through that? I experienced that as well myself for the first time in my life, because I'm palliative in nature. So I actually like death talks. I actually am filled up by this part of what we do. But this was completely different. And I was not prepared for that because I usually handle this so very well. But it did reach a boiling point for me. I actually had a very good experience with my EAP. And I hear everything you're saying, Adrian. I validate all your concerns. I hadn't really even thought about that piece of it. But for me, in specific, speaking with someone that was a nurse, that is now a therapist, that works in my organization and knew the exact community and what we were facing as a community, because we were a hotspot. We had, on my critical care service at one point in time, we had 90 patients on our census and about 6 providers to take care of that. And they were popping anyways, you all know this. The bottom line is, when I spoke with her, she could validate and understand immediately all of the intense emotions I was feeling in relation to our community and what we were experiencing there, and kind of validate that just having someone who worked there and knew what we were going through to say, yeah, you're right to be angry. You're right to be angry with your church. You're right to be angry with all of the things that are going on right now, really helped me to just say, okay, all right, now she's a professional. If she says it's okay, then it's okay. And just allow myself to be angry, because I was very, very angry. I had a lot of anger issues. And so she taught me some techniques about grounding when things got really bad. And I did have to use those techniques at work. You know, I was in the middle of, I was getting sterile for an LP and I just had a total breakdown. There were some other things going on personally, but I just lost it. So I left. I said, I'll be right back. I put the stuff down. I let her lay the patient down. I went in the bathroom. I did my grounding techniques, 5 things I can see, 4 things I can appreciate for smell, touch. I don't even know what all they are, but just to bring you into awareness of the moment, to help you compartmentalize and get through the day. And so I just compartmentalized my way through it. That's how I did it each day, one step at a time. And if I got to that point, I used my strategies to get through the day. I also, on my off days, spend a lot of time in distraction. So I like to hike, spend a lot of time in the woods. I would listen to podcasts, anything that was not related to what was going on, just to kind of get my mind out of that headspace. And then connecting with friends. I have a lot of very good friends who are in healthcare and sharing our stories and our experiences. And my best friend is a pharmacist. So knowing what she was seeing in the community helped me to see not everyone dies from this. Not everyone does.
Yep.
Brianna, this is a small percentage of the population who's dying, because that's all I was surrounded by.
Oh, yeah.
It's going to get into your head about how bad things are in that moment, but having people who can give you perspective on the global picture of it really helped me a lot. And then I I found something else. Like everyone else had said, I found something else that gave me joy that was not inpatient acute care dying all the time. This is about the time frame that I started mentoring NPs and nurses. And I found that watching other people grow and succeed it's a happy time. It's a pleasant thing. It feels like I'm giving back in a way that it's useful versus just, I'm sorry, we couldn't save them, they're dead. It was just a balance. And there were times when I thought maybe I should step away from the bedside. I think many people thought that, but ultimately I'm very rewarded and love what I do. And that's what I kept coming back to, before all of this, before the census surge and all of the issues with the pandemic, I loved what I did. And I didn't want to give that up because I knew it would come back to it eventually. So we are back to that place now where it's a reasonable steady amount that I can handle. And I love what I do. I enjoy it. It's my life's work. And I just kind of keep focus on that. Finding balance in your life perspective, having something that grounds you, having something that distracts you, just trying to put it into perspective. And when it becomes too much, knowing when to step away.
That's awesome. Very sage advice. So I think the common things we've kind of been talking about is not working too much. So knowing like, hey, I'm going to do this. And then I'm also going to have a life outside of this. Finding something you really, really, really enjoy that's going to give that life back to you. Taking your time off. I have to say, you probably want to find a balance between taking time off and then taking time off the Liz way. I usually had 0.1 hours in my PTO box. So then when I got sick, I was pretty screwed because I was like, oh, PTO, I'll take that. Being unapologetic in saying no and don't feel like you need to catch yourself on fire to save your unit. And then some kind of trauma-based therapy, very, very helpful. I would say really checking in with your mental health pretty frequently too, early, rather than waiting until you're like on fire. A lot of people I know start, even like if it was just during the first year or two of their career, started some kind of meds. You know what I mean? To get through the transition of like, oh my gosh, this is just a lot. And you don't have to, but like just kind of checking in. Basic things you'll want to ask yourself are, do I want to wake up in the morning? If the answer is in the last week, like mostly no. Do I enjoy things I used to enjoy? Am I really snippy at my family? Do I have trouble sleeping or am I sleeping too much? If you're noticing those things, like that's when you just start like looking into more being like, ooh, I always tell my patients to keep a mood tracker in your calendar. How are you feeling? 0 to 10, anxious and depressed. We scale both and write it down every day because it's really easy at the end of the month to look back and be like, I think I was sad every day, but if you track it every day, it might have just been yesterday was bad. So you're remembering yesterday, or you had a few hard days, but mostly you're okay. Or it could be the other way around where yesterday was good. People would schedule appointments all the time to come in and they were like, oh, I'm here for anxiety and depression, but now I'm actually feeling great. But if you look at it and their person is sitting there next to them, if they brought them and they're like looking at you like, oh my gosh, because most of your month was really hard, but you're remembering yesterday, which was good, or you're embarrassed and you don't want to say it. And so keeping like track, I do this still in my calendar. I rate anxiety, depression, because I am blessed with both, and how it's doing. So I kind of get a picture of like how it is and what happened recently. Did I not sleep last night? Okay. So we kind of know. Did my patient die yesterday? Okay. Then we kind of know what is going on surrounding it. So that you can start tackling it early rather than waiting until it's like all falling out. Does any of you have any tips for navigating how to transition from work to dealing with your family without biting their head off? Because that's also something I noticed hugely was like I would come home from being at work for 12 hours or however many hours, and it didn't necessarily go well. And then I get home and everyone is demanding everything of me. My children are like, I need this, I need this, I need this. My husband's like, have you done this? Where's food? And I'm like, I'm going to kill all of you. And it's not the best. And so I know Bree, Vanessa.
Yeah, for me, it was the commute. I would drive really slowly home. really slowly.
That's a really good idea.
Lots of time to decompress and then setting boundaries. I have 3 kids, 3 girls. And as soon as you walk in the door, Mom, okay. You are not allowed to ask me for anything for 15 minutes once I get home. After that, after I've had my shower and sat down, then we can discuss what your needs are in life. Decision fatigue. And I talk to a lot of novice NPs or new, and this is legit. I had no idea the transition from practicing at the bedside to practicing as a provider. The decision fatigue as an NP will send many people away from it. They will quit.
Mhm.
It is astronomical. You're being asked things all day long that you don't know the answers to. So then to walk in the door and have even more, even though they're in, hey, mom, can I have a sleepover? I don't know.
Yeah. Uh-huh.
Like, I need a minute. Okay. I don't know. I got to think of the ramifications of this. What are the risk benefit? What am I going to get out of this? What can we do today? Like, I just need a minute. So setting the boundaries for me really helped, and driving slow, listening to a good podcast or music on the way home, and then being ready to come into the house knowing, okay, I have a whole group of people who rely on me, who I love, who I should pour into the most. They need the most energy and the most love from me. Let me have a minute until I can recharge so that I can give them that. It's super important. These are the people who are going to be with you for the long haul, but it's hard.
I agree with a lot of what you said, Bree. I haven't thought about the slow drive yet, though. But what I do is my spouse kind of knows that he calls it my venting hour. But my first hour after work, he lets me vent about anything that went on throughout my shift. And then whenever I get out of the shower after work, which is usually right when I get in, that's when the kiddos can come, they can ask me whatever. But we usually try to have like 10 to 15 minutes of like no questions, just chill, calm time, silent play, and then we go on from there.
Yeah.
I'm looking at Adrian screaming at the top of my lungs helps, and I don't even have kids. This is what usually ends up happening with me is my children are like, can I have goldfish? And I'm like, stop asking me questions. So we all scream together. It's very fun. So I'm going to try to implement some of those techniques.
I don't have little people when I get here, but we have a rule that is just nothing until after the shower, and it just runs straight to the bathroom because no one bothers you in the bathroom.
Really?
And I just keep Epsom salt like close at the tub, and I choose shower or tub, and sometimes my feet hurt so badly that I know I won't be able to get back out of the tub, so I won't choose to soak. But then the shower is the move. But I have like this exfoliating soap. It's so silly, like these little things.
No, but that's literally what we're talking about. Yeah, little routines.
Certain days where I've been on the unit just back and forth. It's like, oh, I didn't sit down for 12 hours. I will use that scrubbing soap on my feet just because it smells the best.
Yeah.
It doesn't do as much as my brain thinks it does, but like.
And sometimes those rituals are really important. You know what I mean? Like just the little things of like, I'm going to go home. I'm going to do this. Some nights I made it through night shift because I knew there was a Jolly Rancher waiting for me in my car. I was like, I'm going to get to the Jolly Rancher. Like, because how I made it home on night shift was I would drink ice water and 8 Jolly Ranchers. And that was how I made it. Pretty much. Sewing for Joy says there's a book called Boundaries and When to Say Yes and How to Say No to Take Control of Your Life by Dr. Henry Cloud and Dr. John Townsend. That sounds like it would be an excellent book. Second opinion. Can you write that down? How to say no, I think, is hard because we're usually sort of people pleasers. And we want to say yes. And it's not our job to say yes. It's your job to say no. Okay. We're going to learn that. It's your job, if you don't have it in you, to just say no, because it's going to be more helpful to your unit in the long term or wherever you work to say no and then protect your sanity and be there for longer. You know what I mean? Than you saying yes to everything and burning yourself out like crazy. And that's not great. My JCA says my PTSD has been so real. I've been a nurse for 4.5 years in grad school. And I ask myself every day what I went through with being a nurse. And I think that's very valid. And you are not alone there, friend. I think a lot of us have probably waxed and waned. Go watch our video on like, would I have done this again? Where we all have all the feels on that. I was the only one who said I would not do this again. Everyone else said they would do it again. And
I thought Adrian was going to be an investment banker.
I know.
Was that? Maybe she's changed her mind since then.
Uh-huh.
Yeah, I think at 35, I mean, I didn't become a nurse till I was 39. So I probably would maybe have opted to go to law school.
Oh, you would have been a terrifying lawyer.
That's what I was going to do at 29 when I got recruited by the union. So, but they work a lot too. It's like, what another thankless job. Like just round the clock work, you know?
Yeah. Yeah.
I also think like just having something that like, like I'm a big fan of aromatherapy. Like smelling something can kind of snap you out of it.
Mhm.
Just like having the rubber band on your wrist, right? It's like, or like I, might have a crystal in my pocket or something. It's like anything that's small and symbolic can help us make those
Mhm.
transitions, and I don't have kids, but I had, we've all been through it. Like if you don't have a spouse or a partner who does those 12-hour shifts and is used to you being gone 14 hours or 16 hours or 20 hours a day, it is really hard. There's always these uber expectations on you. And, there was times where I would be like, showering at work, getting dressed, going to like a party or something and showing up, and it'd be just like zombie land. And I'm not a drinker. So I was very conscious to not get in that habit of alcohol because I saw a lot of people doing that.
Mhm.
Which is, but I think there's other things that can be more beneficial, to help people's mood. But yeah, I mean, we have to, and I wanted to add something too, when I think you mentioned it, Liz, earlier, is that, we're on fire, right? So many of us in nursing come from being on fire. We're
Mhm.
drawn to nursing because we've lived a life on fire, and
Mhm.
that's what we know. So we're drawn to that. And then the
Mhm.
pandemic just pushed us over the edge,
Mhm.
right? And so we get to have this opportunity to like put the fire out, heal the unhealed trauma, calm down, the lizard brain, our autonomic nervous system, right? The amygdala. This is the time, right? And so I hope everybody really sees and creates an opportunity for themselves to do whatever healing work that they need to do, because you deserve it. Everybody deserves it. And if nothing else, you can change all the careers you want. We still
Mhm.
take us with us, and be the best you can be, and get that healing, whatever that means. And it can mean big changes. I know a lot of people, probably next to actually being in nursing school, I have known so many people to change their lives radically, including me. I moved across country. I was like, whatever, I'm just leaving. People leave relationships. You got to do what you got to do to save yourself, because those pieces may no longer fit, and that's okay. Just forgive yourself. Know that you're perfect, you're okay, and you're going to be fine.
Yes. And also this comment. I like that Nurse Adrian seems like she would kick someone's ass, but then goes home and does a royal therapy. I'm going to punch you in the face with my crystal.
100%.
I
I
do.
love that.
100%.
So true.
I'm a Reiki master too. Did you guys know that?
No. Oh my gosh. Do you do like that healing touch stuff?
I don't touch people. I just do energy work.
I think healing
I
touch,
don't
you don't
need to
actually touch
touch.
people. I don't really
Yeah,
know.
I don't really need to touch people, but the state of Virginia says I have to
Uh-huh.
be a massage therapist. But yeah. I'm a dichotomy. I'm got a little bit of everything.
First,
So
Cal says,
lovely.
there's so much overtime hate. Go get that money. If you want to work 100 hours in a week like me, go do it. But also remember to take care and do 30 hours, 6 hours a week. Cal like legitimately works 80 to 100 hours a week.
But it's okay to do that if you take the next week to just do the regular. Like if you do that for
Cal
2
does
weeks
it
and
every
then
week.
every week.
We don't know if we recommend Cal's. I mean, Cal's doing it. He's like our social experiment buddy here. He's going to see if he can. We're going to see what happens with him. He's working.
We're going to test his immune system in
Exactly.
6 months.
We're kind
See
of
what
our
happens.
money.
I
We're
mean,
like,
if it's
hey,
a means to an end, and like, hey, how many of us have done that because we want to buy a house, want to buy a car, want to have a vacation? You grind it out, right? But again, I can just say, like, I love all these travelers that are young and they're working tons of hours and stuff. But I'm like, I'm 54. Like, I didn't become a nurse till I was 39. My body was already like, maybe not feeling it. You just cannot sustain that workload. Period. It will not happen.
yeah.
There is that 1% of the population that only truly biologically needs 4 hours of sleep. But
And
they're
we think
like
it might
so
nurse-
rare.
I
Cal
used to
might
be
it.
that person.
Cal might
I
be
was
it.
that person. I never slept more than 4 hours until I was about 45 or 48. I mean, and now I'm like, don't just wait till menopause, everybody. Just wait.
Something to look forward to. Jason, thanks for becoming a channel member. I appreciate you. Enjoy my Rennie weird rambles that you find there. It's an interesting place. Let me see. They're there. Yvonne said, I think mental abuse starts in nursing school. The instructors tell us not to work, to forget about social life because we're there to learn and forget everything else. And that's a very good point, that starting then they kind of like pull back and say, like, I don't know about yours, but mine on my first day of NP school, they said that they were like, this is, you're not going to do anything else for 3 years. If you're married, you're going to end up divorced. Don't you dare get pregnant. And that was their speech of welcome. And cool. Like, cool. So yeah, that I get it. That's a mess. And none of that is good. You know what I mean? Like everything in moderation, including your job.
Yeah, they told us the same things too. And it's like, great, wow, happy to be here.
Exactly.
Looking forward to a divorce, you know?
Exactly. Like, look, yeah, a mess. An absolute mess. Also, we're struggling with the fact that of your age. And yes, I think Reiki is actually super, I know, isn't that crazy? Neither of you look it.
Thank you.
So whatever is actually happening with, it's
all moisturizer and good lighting.
I agree. My older gay brother did take me to the Clinique counter when I was 13. So I will say that. But it's genetics. No, I have really very little to do with it.
And good lighting.
Also, I think you're lovely humans. And I think sometimes that makes you just like glow from the inside. You know what I mean? Okay. Final thoughts.
I think that there's not a one size fits all. So from everything that everybody has said today, find what speaks to you, find what you can relate to and follow that, right? And whatever doesn't work for you, then don't follow that. So that's my last 2 cents.
Play around with it. You know, find your friend with ADHD and try their hobbies that they have dropped. If you live in the southeast Pennsylvania area, come find me. I have a whole basement filled with things.
I just drove through Pennsylvania, Liz. I know.
I have a piano and a guitar that I haven't used in I don't know how many years.
Yeah. I'm like, just find your ADHD friends and be like, what would you like to do? Would you like to learn to quilt? Over here, I can show you all of, like.
You see these paintings behind me? These are my COVID paintings. I painted all of these.
They look really cool though. I love
about
them.
100 more. So yeah,
and be okay. I think it's fun to just play. You know what I mean? Outside of, I think we just need like silly things. So you don't have to be good at it. You know what I mean? Like you don't have to be good at it. Just go outside and do it. That's what my yard is for. Half of my plants are dead. I was like, I don't know if this can grow here. Turns out no, but some of them survived. That's what the Lowe's clearance section is for. Play. Right. Just try. Right. Exactly. You don't have to be good at it. And YouTube can teach you anything.
Very true. Plant talk is where it's at. I would say, my parting thought for folks is really to remove all obstacles to your joy. Remove toxic people, release toxic people, toxic jobs, toxic habits, beliefs, and thoughts. And that we have the power. You have the power to change. And it's not easy and it's not one size all. Like I 100% agree with you, Bridget. You've got to find what your stride is, but do not stay around toxicity and toxic people. They will hold you back like crabs in a pot. You're going to be fine without them. Just let them go. Find your tribe. Find your tribe. And it may be lonely for a while, but find your tribe.
And stand up for yourself. I missed this comment earlier, but Sewing for Joy said, I was working as a nurse and pushed and driven to exit. I wished I had been able to say, you know what, I quit. And now it's been 9 months out. And I think knowing that you can stand up for yourself and you can say, I quit, is so helpful. Like, if you see yourself going down that point where you're like, oh, I have like actual concerns about this. It's okay to just stop and figure something else out. You know what I mean? If you have to go, there are so many everyone is hiring, if you're like in a situation where you're like, I don't necessarily have any other job lined up. I just need out. Everywhere is hiring. You are expert at communicating, at organizing, at doing all sorts of things because you're a nurse. You'd be able to like run that target like a boss. You know what I mean? Like, go do the thing. Like, it doesn't matter where. You could be an excellent barista, or I'm telling you, being a bartender, fun. You use a lot of same nursing skills. You have a lot of therapeutic communication, and then people just hand you their money. They're like, wow, that was very therapeutic. And you're like, thank you. Thank you. And thank you for sharing that Sewing with Joy, because I know that's hard to talk about. I'm glad you're taking time working on healing me. I have no idea what I'll do next, and that's okay. That's okay. Most of us don't know what we're doing next. Nursing was my 4th grade dream, and that's okay for your 4th grade dream to be different than your 35-year-old dream. You know, I thought I was going to do primary care for the rest of my life. Turns out, nope. You know, no real plan except for ranting on the internet with these lovely people. And that's okay. Like, it's fine. Sad my boss encouraged me to see a counselor, yet denied me time off to go to my sessions. And if you're finding that like your employer is not allowing you to take the time to get better with you, if they don't value you enough for that, go somewhere else. Like, go somewhere else. You are always worth that time and that energy. And thanks for sharing that with us. That was, I think a lot of people are going to be able to resonate with that. And I know that's hard to share stuff like that. So thank you, friend. I appreciate that. Scott, final thoughts.
You have to take care of patient number 1 before, it's the oxygen mask on the plane before someone else. Get out of your own way. Allow yourself to do or not do what you need to do to take care of yourself. It's okay to quit. It's okay to change gears. It's okay to try something new. It's okay to fail. And the best advice I ever got, I've repeated for years and years: work, play, eat, sleep. Do all 4. You have to have some way to contribute to the world. You have to have some way to just have fun and explore your interests. You have to eat. You have to put the fuel in the machine, and you have to sleep. And the only thing I would add to that is socialize, is to surround yourself with the good people that lift you up. And if anybody else, just run away from. And live an excellent life. You only get one.
Yep. Bree, final thoughts.
Well, I'll just tell everybody else, I think finding your coping skills to get you through, and then weighing how many good days and how many bad days you have,
Mm-hmm.
I broke up with a dude in college because we were having more bad days than good days, like, okay, when you're tipping the scales, when you go to work and you're frustrated and you're cranky every day, it's time to try something new. But, as you said, there are many other things outside of nursing you can do. But even within nursing, I would say probably 75% of the ICU nurses I work with quit and went to work in PACU or pre-surgical testing or something that just had a different focus and a different stress level. If you're finding it stressful because you're talking to patients too much, go spend some time in the OR. Just the beauty of nursing is there is a whole world of things that we can go into and practice, as opposed to our physician colleagues and even some NPs. You can try pretty much anything, and there's good pay, there's different work-life balances. So just know your limits and know when it's time to try something else, and live a good life, as Scott says.
Mm-hmm. Nia, you're up.
Everyone said such lovely things. I think in the moment of being in the shift where you feel that way, should I be exiting? Should I think about changing my life choices? I would say, to get through that moment, this too shall pass. You are on a clock. The clock will ring and you will be able to walk away from that moment. And I don't think you should make decisions in that kind of setting, that kind of mindset where you feel all of the pressure. But when you are considering doing like a life switch or a new career or just even a new job, you don't want to leave one place and then just jump into the same situation somewhere else. So whatever that is that does make you feel calm, does make you feel relaxed, where you have clarity. For a lot of people, it's like running or swimming or just reading a book or something, to where while you're doing it, you can hear all your thoughts clearly and you can be, I guess, practical. Get into that headspace, and then let yourself be there for not just 5 minutes. Like, do it kind of repeatedly for a little while so you can like really make a good decision that you feel excited about making. Once you feel excited about making that decision, I think to move. And I think I'm just speaking from personal experience right now, because I had like this dream that I would like go into nursing and then also do other things. And so I always kind of want nursing to be like my part-time job. And that sounds like weird to say, but I know I can only contribute like the best version of me for only a little bit of time, but I still really want to be there.
Yeah.
And so I'm trying to like build myself outside of nursing as well. And it's weird because other people like don't really relate to that at all. Like I can't explain what what I'm making happen, but like
I think healthcare part-time is the sweet spot.
I think it's just like I want to be here and but I can't be here all the time. But it's when I'm here, you're gonna get the best experience out of me possible.
And I love that. I love that.
So I don't know, just consider letting yourself time to think about it.
Yeah, do you have like a social media?
Kind of. I don't.
If you don't, you should like start one where you just come in and like say sage little things. Be like, here's this.
I would.
Go. You have lots of like little
If
nuggets.
people want to hear it, I will make it. I technically have a YouTube. There's 2 videos. They're completely unrelated. One is about being float pool PCA, and the other one is me washing my hair.
It's fine. I started my channel about diaper videos, cloth diapers. So you're fine. It turns out great every now and then. Someone's like, when's another this? I was like, oh, we turned to a different something, but.
Well, you've done so many videos over the years, Liz. Like I've been watching you for years. I don't know how many years, but you've definitely given me energy throughout this whole process.
Look into my ADHD. I'm like, I'll do this. I'll do this. There we go. Merce Cal said, final thoughts, show comparison is the killer of joy. Learn to take joy in others' success. And I would say, like, don't look at what other people are doing because they're not you. And at the end of the day, when you're laying there on your deathbed, you're not going to be like, wow, I hope Bridget thought I did good things. Bridget isn't you, Bridget's not there. Like, you know what I mean? Nurse Scott, probably not going to be there. Like only up to what you want to do. And exactly. And
I wish I took that over time.
Yeah. Exactly. And Nurse Adrian said, if you work through the pandemic, know you did enough and you did your best. Give yourself grace. And I think that is hugely powerful and very, very true. We all did our best and we had no idea what we were doing. And hopefully we never have to do that again. And Carla says, nursing skills are applicable to so many other careers. Wishing you all the best in your endeavors. Exactly. Vanessa, any final thoughts?
I think I would say that just don't limit yourself. Don't feel like whatever role you're holding at this time or in the future, they'll find a replacement. I hate to say that, but they'll find somebody that could do that job. You have to find what's going to keep you happy. After the pandemic, going through the pandemic, and after I was a charge nurse, and I found myself get into that point where I needed to break away. And one of the things that held me on a little bit longer was there was nobody there that could replace me because we had a lot of newer staff. But then I got to the point where I knew that my mental health was suffering. So jumped back into travel nursing and now much happier with the flexibility and the freedom of it. So never tie yourself down. No matter what situation you're in, give yourself that freedom and that flexibility to find what works for you.
That was perfect. Thank you. And I would probably just say, do whatever figure out, recognize that you are worth prioritizing yourself over a job. The only person who needs to absolutely bend over backwards in the job is the person who owns the company. Okay. So like in my job, I can bend over backwards, cause I'm my own boss and that's fine. But nowhere else do you need to do that because they will figure it out. It's okay to prioritize you, taking time off, finding other things, check in with yourself a lot. Am I finding joy in other parts of my life? And if not, let's work on that. And then just do whatever feels right next. You don't have to have a long-term plan. Sometimes you just need to know what feels good next. Okay, do that. Whether that's a career switch or just hi, I think I'm going to try doing Pilates because I enjoy my whole entire body. hurting. Let's try that. Whatever it is. Oh, I'm going to get into Reiki. I want to try out, like, if you're going to go Google like crystals, or if you want to go try, whatever it is, I'm going to go hike like Brie, like whatever it is. Just if it sounds interesting, like life is just about exploring what sounds fun. You know what I mean? And go see. And that might turn into something totally different, and just be open to it. You're not, try not to be too stuck. YouTube can teach you literally anything you want to know. You can learn on YouTube. So it's fine. Go start painting. Go kill half your garden.
Play music.
Exactly.
Play music.
Exactly. It's
Dance,
not that.
dance, dance.
Dance.
Perfect. All right, friends. Please check out all of these lovely humans. Their social medias will be linked in the description. Thanks to everyone who joined us for the first time. That was super exciting. I feel like you all had so much excellent advice. This was like perfect. And yeah, I appreciate all of you being here. But do go check out their channels, because they're really just donating their time here, and they don't get anything out of it. So if you go check out their channels and watch all of their things, they all have excellent sage wisdom they share other places. Mama Nurse has a whole video that is like this. Sorry, I thought it was going to be smaller, but there's your face. It's beautiful. So here we are.
Thank you.
Nurse burnout tips. I will leave that linked down in the description below. Scott, do you have tips on burnout? Bree, do you have them? Bridget?
I haven't done that as a topic yet. No, I have other good stuff.
Okay. Yeah. Everyone has other good stuff. I was just going to link all of this stuff. But we'll link to other fun stuff for all of you. They all have excellent channels, or they wouldn't be here. It's a very difficult process. I'm like, how does your YouTube look? All right, you're great. Let's go. It's worked out well so far. One day we're going to have a dud. We're going to be like, oh, I did not screen that well. We need a new process. But thanks for being here, friends. I very much appreciate you. I appreciate everyone sharing in the comments too. I think I will leave them on for the replay, so you can always go back and look, or if you're watching this on the replay, you'll be able to have seen them. Because a lot of people were just sharing and really opening up, and I appreciate everyone who did, because I think one of the hardest things is just to think it's just you. You know what I mean? That I'm the only one feeling like this. Everyone else is handling it so well. And in reality, that's not the case. You are not alone. You are more than enough. You are worth doing the things for, and you, my friends, can do hard things. I will see you next time, friends. Bye. Let's see. And then everyone gets to hear this. Bridget, I forgot to tell you this before. Bridget and Nia, you can stay after, and we just chat, and then we bounce. So just so you know. Okay. Bye, everyone else. That didn't really apply to you. Here we go. Monday we'll have an official end screen. We'll figure it out.